All right, Nisha the PA, we are live.
Hey guys, it's Nisha the PA over here at Dr. Emer's office, and today I have my gorgeous patient just 1 month post-op. Now, what we're doing right now is the recommended treatment, which is Venus Legacy, and you can start the Venus Legacy at about 2 weeks post-op, although he's 1 month post-op, which is perfectly fine. I'm going to tell you a little bit about my client here, and then I'll kind of explain to you and walk you through the process of what we recommend. So my client previously had a little bit of liposuction. This is a revision case. So in order to go ahead and fix that, we had to do a little bit of a mini tummy tuck. You can't quite see his scar now, but
Let's show them.
Show it to you just a little bit. It's very, very minimal. So you can see he is healing. I mean, you can barely see the scar. He's healing very, very nicely. So this was a mini tummy tuck. We did liposuction and some internal heating with Renuvion. One of his problem areas was really more so the lateral chest. So you'll see on this side, he's much more flatter. I want you guys to really kind of go in and look at his before picture. And this is where you can see he had a little bit of kind of a little fat pocket here on the side of his torso, on the side of his chest. So he really wanted to go ahead and get that taken care of. Now this is an area that a lot of doctors won't touch, but here we're able to do that and really nicely contour on the side of his chest and his torso and really take away that problem area. He's only 1 month post-op, so he is still in the healing process. Remember, you're really going to see the results at 6 months to a year out, even though you are going to see, you know, it's improved on his torso. His abdomen will get a little bit flatter as well, and then along with the body treatments, True Sculpt, and Venus Legacy, you'll also get more improvement from that.
All right, guys, our patient did more than body sculpting. He actually did FaceTite, where we go in and we internally heat, melt the fat out, use a little bit of lipo, and we remove that right there. His jawline looks spectacular right now. We did do that, and we did a little bit of filler to his chin to give him a little bit extra right there.
So now remember, guys, FaceTite is a really amazing treatment, especially if you want more definition to your chin, you have a little bit of kind of no shaping here to your lower neck. FaceTite is a really great procedure to really tighten this up and to give more definition to your jawline, which, I mean, we all can use a snatched jawline, right?
We all could. Okay, Nisha, we have some questions about Venus Legacy. Let's see if we can answer those. When you do Venus Legacy after operation, how many procedures and how much time in between them?
So when we do Venus Legacy, you want to start at about 2 weeks post-op. Now, of course, some of that will change depending on what you had done, but about 2 weeks you can start Venus Legacy. I always recommend that you do Venus Legacy in a series of 3, and really the more optimal thing to do is in that first week, you do 2 treatments about 1 day apart, and then you can continue with Venus Legacy every 1 to 2 weeks in between. Now, this I use in another treatment or with another treatment called True Sculpt Flex. Together, I like to call them the tone and the tighten. Now, this is the tightening part of the tone and tighten. The Venus Legacy, which is radiofrequency energy, this is going to help to further decrease swelling and tighten the area. We all know how great radiofrequency can be. Now, you can combine the Venus Legacy with True Sculpt Flex, and you're going to get the toning aspect of it, which True Sculpt Flex is a 45-minute workout.
Okay, guys, so someone said, I need something like this, and I'm a female. Guys, tomorrow on Instagram Live, we are going to have a female high-def lipo. She is a revision case as well, so very similar. And we are going to go live for that multiple times. We're going to be doing lasers to her face as well, fully ablative lasers. So make sure you follow us. Stay tuned for that tomorrow. And Friday, we have another case, which is going to be a male high-def lipo and facial sculpting there too. Someone said, did he get Gladiator? No, guys, he did not get the full Gladiator treatment. He's not looking to be extremely sculpted. He's a revision case and just wanted to get back to normal, get a nice flat body, make himself look great.
Now remember, guys, we can tailor our treatments to you. If you want more of a sculpted look, you want the 6-pack abs, of course you've seen that we can produce that. If you also just want more of a leaner shape, you don't want it to look like you really had anything done, but you want that really nice definition and contour to your abdomen, then you can have that as well. There's no, I mean, everyone doesn't have to look exactly alike. We really want you to look how you're going to feel your best, right? So in this particular case, you really just want a little bit more definition to his abdomen, but not really the six-pack look. And he's going to be able to get that with the liposuction that we did, the internal heating with Renuvion, and removal of the excess skin. This was kind of a problem area where there was a little bit of excess skin here from previous liposuction. You'll see it more so here. That can only be removed with a little bit of tummy tuck, which we were able to accomplish. Now this area is nice and flat. Doesn't have any more of that extra skin there, that extra fat. Of course, that is a mini tummy tuck, liposuction, and internal heating with Renuvion. In addition to that, we also did a little bit of fat grafting to the chest. No gland removal or nipple lift, but we did do fat grafting to give him a nice, well-defined chest.
Alright, guys.
You kind of take a look at his before and after and see how nicely his chest is defined now.
Alright guys, previously our patient did have pectoral implants. For anyone with implants, it is perfectly safe to do fat grafting as long as you go to someone who knows what they are doing. The border of his, we give you a virtual or in-person consultation. We're very happy to do that and get you on board with us. Alright, lower pouch of the tummy. Guys, it is liposuction, and you can see he's 1 month.
But you can see here we did a little bit of a mini tummy tuck on here. Right now he's 1 month post-op, so the scar with the appropriate skincare is healing very, very nicely. In addition to that, to really after treatment with us, we recommend you do laser treatment at 3 weeks post-op. So he's going to continue, even though it's
weeks ago. I'm back to you guys. Send us a DM on Instagram. Send us an email at jasonemermd.com. If you DM us on Instagram, I will make sure that we get back to you as soon as possible. Okay, let's see here. Was he under anesthesia? Yes, he was for that. Right now, he is awake. He has no numbing. He probably actually feels pretty relaxed. How does the venous legacy feel?
good.
Can you tell us how it feels?
It's like getting a massage. Wonderful.
I can see with a little bit of warmth to your abdomen. As I'm applying the applicator to your abdomen, there's really no pain. There's no pain at all. I see. This is really just to heat the skin, help with swelling, help to...
He's single or taken? People are asking.
They always want to know.
We can't tell that. That's all up to them to tell.
They're always hitting on the patients.
All right.
Now, of course, surgery with us, body. Right now, we're doing the abdomen, but you can also tightening. You can do venous legacy. It's not just limited to the abdomen. You can do this now. You can come in tomorrow if you want. We'll be here. Have space in my schedule. Give us a call.
And guys, you can't come see us on the weekdays. This week we're gonna have our once a month Saturday clinic. We'll be open on Saturday.
We'll be here.
Nisha the PA will be here for treatments. We'll have Dr.
We will do this with the TrueSculpt Flex. TrueSculpt Flex is really an amazing, really true with venous legacy. We call it the tone and tighten. So this here is tight. The optimal result.
Now I know if we tried something similar to TrueSculpt Flex on Nisha the PA. Nisha, how does that feel?
Oh my gosh, guys, I tried body tone. It was so abdominal. So with 2 treatments a week for 3 weeks, you're going to get a 6-pack abs. So I'm going to do some more treatments and I'm going to show you body tone, which is very similar to Flex, and helping with stimulating contractions. And really, you can go to the gym, guys, and we're in your gym.
And we filmed it too with Nisha. We filmed it and we will show you guys that. So let me take you guys a recap. We did do some FaceTite as well, for those of you wondering. We did go in there, we made a little small incision on the chin, and we go in there and we internally heat, melt the fat away, and it tightens his skin. Right there, his jawline and neck. About 3-6 months to see best results. He's only 1 month out right now. Looking better. I can tell much better definition in his jawline, in the double chin. And we did right there for a little bit extra.
So of course, a little bit of a recap. This was more of a product that we really wanted to kind of smooth out. We were able to really achieve these results with doing a mini tummy tuck or to where that area is now nice and flat. A little bit of internal heating with Renuvion. We also did a fat grafting to the chest, and of course we did FaceTite, which is going to give him a nice chiseled jawline. Right now we're doing Venus Legacy, which is Radiofrequency, and then we like to combine this with True Skull Flex to go ahead and give him the best results. His scar is super minimal from his tummy tuck, which of course is the goal with using the recommended skincare after treatment, doing the recommended aftercare, which includes hyperbaric chamber, IV therapy, lymphatic massages. All of that helps to guarantee that you get really great results. 3 weeks after you do your procedure with us, we recommend you do laser treatment to your surgical scars to make them super, super minimal. Right now, look at this scar, guys. This is amazing.
All right, guys. Thank you for joining. If you guys follow us, we might go live for TrueSculpt Flex next. And we're going live tomorrow during surgery in the OR with Dr. Emer. And on Friday as well. So make sure you follow us. Stay tuned for that. Thank you for joining us.
See you guys next time. Bye, guys.